Hi everybody, it's Dr. Ahmad from the clinic in Harley Street, and I've got Sonia with me today. Sonia, you've had some lip enhancement done before, but you feel that the volume just on the lower aspect of your upper lip is slightly lower because you've got a defined border out there. In addition to that, there's a ratio of 1 to 1.6 between the upper and lower lip. So the technique that I'm going to use, the technique that I will want to use here is just one for sort of voluming and sculpting. We're happy with the definition, we're just going to go in and we're going to volumize and sculpt. What I have done is I've given my patients a dental block, so if you can just open your mouth again for me please. That's fine, and relax. And what we are doing is we're literally placing micro droplets of filler. We're not wanting to put too much in because this is just a corrective procedure. She gets a lot of swelling straight away. So that's why I like to give a dental block first. When you put local anaesthetic on, it causes the lips to swell a bit more. And then what we're going to do is just do a bit of revolumizing equally just on the lower lip, just to maintain that ratio. A very global diffusion. Sit up on please. Perfect. Perfect. And just open your mouth. Excellent. Relax. Okay, so what we've done is we've done an enhancement just of the volume, not the definition. Our next stage is that I've said to Sonia that when she does do the lips, because she's lost a lot of volume, we are now going to replace the volume in the mid-face here, just to improve the ratios and to lift up here like this. She's lost a lot of volume, and it will also make her lips look a bit more natural with the rest of her face. What we're doing, Sonia, now is we're just drawing the landmarks. This is not where I'm going to be injecting. This is just my landmarks, okay? Do you have a lot of volume loss? So Sonia has been unwell and lost a lot of volume on her face, so we're going to now do a lot of volume replacement into the medial fat pads and also the mid-face area, Sonia.
Yeah.
And I think we're going to swallow for I think today. Lie back first and just relax. And this injection is done on the bone. And I like to use a coding system, it's called MD codes. We can identify the areas. So this is with CT3 and the CT2 area. And there's predetermined amounts that we would inject in there, but as Sonia has got a lot of volume loss, I'm using my own judgment to decide which how much is to go in where. Just because the fat has gone from there now. So what I've I've done is I've injected both sides now.
Yeah.
This side, the structure is different from this side, and that's quite normal to have asymmetry. And the sort of cheek on this side is further forward and higher up. So when we're injecting in there, we have to inject different properties from this side. We can't make it symmetrical, but we can try and create a balance. Now, because you've suffered a lot of volume loss just from your health, I'm now going to put in some very specific points just along there where I think the fat pads normally should be, over and above what our normal injection points are, just to see if we can restore some of those features for you again. Okay? We're not creating new features, we're just going to restore original features. Fantastic. So, Sonia, if you have a little look.
That is amazing.
So what we've done now is we've gone ahead and restored. So what we've done here is we've restored the mid-face volume up here. So if I just put that a wee second there. So we've restored the mid-face volume up here. And also because we've done the lips earlier, it's made the lips, the size and the symmetry of the lips look a lot more natural to the size of your face. This is all that we're going to do, and on our next visit, you've got hollowness in your temples up here, Sonia, and when we do that, it will help not just lift the skin to the side, but also get rid of that indentation and give you a bit of firmness here and a firmness on this side. So that's what we're going to plan in for our next visit, is just to fill these areas up here for you, and that will finish it off. I just want this swelling to settle down, I don't want to put in too much. So we're revolumizing areas of weight loss, so we've managed to do the mid-face, but really does require the temple area filled and lifted to have that effect there and that effect there. And also when Sonia is in on our next visit, we're going to start the treatment for the fine lines and the wrinkles, okay? And we're going to hydrate the skin and put in some deeper PCL injections, and what they will do is stimulate natural collagenesis. The filler is giving you that instant lift, etc., and something will be working behind the scenes just to give you a far better result. Okay? We'll see you back in 2 weeks. Excellent. Thank you.